Welcome to Health IQ, a podcast from the Quay County Health Council. In this podcast, we are exploring a variety of health topics that affect our community and probably yours too. We are not professional podcasters, but volunteers that have a passion for wellness. We will share practical ideas and resources for people with limited access to services, and we have some fun tips to help you and your family stay healthy and well. Increase your health IQ as you listen to our members as they talk and share with experts and others about the health matters that matter to you.
Innovative approaches to rural health using digital media and podcasts.
On today's episode of Health IQ Podcast, we will be sharing about our journey into digital media and podcasting to reach new rural audiences made possible by a New Mexico Better Together grant. Joining me at the table today is Joyce Runyan, and she's also being part of the crew. And our other crew member is Bobby Hockaday. We could not do this without him. Joyce is our assistant council coordinator, and I'm sure when she took this job, we had no idea. I had no idea that we would be getting into this. And I am Brenda Bishop, the Quay County Health Council Coordinator. In 2021, health councils were working to help families navigate COVID through education about COVID, organizing vaccine clinics, distributing test clinics and masks, and helping fulfill whatever needs were in their community. We were using and expanding our social media to provide information on a variety of resources, helping families cope with being at home and those kinds of things, giving them ideas of things to do with their kids. And our committee that was looking at equity and health equity in particular was talking about how we needed to expand our digital media to reach younger and different audiences. And they suggested that we start using video. And we had done just very minimal videos filmed on my cell phone.
Yeah, cell phones, iPads, regular things.
And not very good quality. And of course, if I was behind the camera, really poor quality. One time I even accidentally called 911 while I was trying to hold it in the tripod.
We learned a lot.
Yes, we did learn a lot even with that. But about this time that we were discussing that and maybe utilizing kids to help us make videos, a grant application came across the computer that was looking to expand vaccine uptake in rural communities with innovative ideas.
Innovative.
That was the word. So we said, that could be a fit. And we put together a plan and submitted to the application. And we were really excited when the Better Together Coalition accepted us for their second year of funding. They had a first year with like 5 groups, and then they expanded. Their funding was from Center of Disease Control, so it had some stipulations that went with it, and it was administered through the Department of Health. But the main people who were administering it that we reported to was Momentum Santa Fe, who then reported up the chain. Yeah. We are the only health council in their coalitions. And we're the only organization on the east side of the state, which for those of you who may not be from the east side of the state, feelings are a little different over here.
A little more conservative.
A little more conservative. Yeah. And just a little different. So our vaccine numbers, especially around COVID, were very low. So that was where our work started. And we attended their coalition meetings. They got their bi-weekly updates, learned whatever we could to help us on our journey.
Yes.
Which had many parts to it.
Yes.
And so our first part, we just jumped right in and we hired a videographer.
Guess who that is?
And he's still with us. As crazy as we are, we could not be doing any of this without Bobby. And we appreciate you joining us and teaching us. And he
Yes.
taught us. We had some workshops, so we learned a little bit. And then we had already recruited a teacher, and we went into her classroom here at the local high school.
Yeah. Well, our original plan was working with youth, the older demographic in high schools, and doing that throughout the county. And so that would have been at least 3-4 schools. And we were going to go in and teach them all this stuff and let them make their own videos. And we had a change of plans.
Right. We were even going to buy equipment for everyone until we learned how complicated the equipment was to run.
Yeah. Yes.
And, and the care it takes if you buy quality equipment.
Yes.
And we were even going to teach them to edit.
Oh, yes.
But we learned right away that we didn't have enough time working in a classroom setting to be able to do that when you only see the kids once a week for
an hour or so, maybe.
For an hour.
Yeah.
Or less. And so we felt very fortunate. We taught them some things about filming, and we taught them about script writing. Oh my gosh, I had no idea what went into writing a script and all the different cues for the actors. I was just like, this is hard.
It doesn't look just like a piece of paper. If you do it right with the names and all the pieces, and Bobby will probably say we still don't do it right.
No, we don't.
But we do it good enough.
And then even the clapper.
Oh, yes.
There is like all kinds of things that have to go on that and codes and stuff. And I'm just like, oh my.
And this is like so super important because when we record, it's just something that says, okay, we recorded it. So we have to match all this up to what that is and change it and make sure it matches and do that with the audio. And so that's really important. So thank you, Bobby.
Yes. And then I set up, or we got ready to start editing our first things. Oh my gosh, that screen freaked me out.
Yes.
So I backed out of editing because my computer was too slow. Even Joyce's, internet was too slow, and Joyce's computer was too slow.
It was great for doing paperwork, but not for editing digital media.
So we did finally get her a new computer, and that really helped a lot. And she and Bobby have really picked up that editing piece, and I'm so appreciative of them. Try not to overload them, because I can create all kinds of video ideas if I can get the people to record them. But it does take a lot of time on the editing end. So we worked with these students for 3 or 4 months.
Yeah.
It was a long time. And by the end, we had 5 videos. A lot of the students chose at the end not to do video, not to complete their video. They did the first part with the research and all that.
Yeah.
But they chose their vaccine, and they could choose different vaccines than COVID. And they chose their vaccine, and they researched their vaccine, and they wrote a little script. And we had a couple of really cute ones.
We really did. And I think a lot of that is people kind of get intimidated about being on this side of the camera. And so it's people, well, okay, I'll do all this stuff, but I don't want to be seen. And so there were some really great ideas. We did have, I think you said there were 5 that finished that. They're actually on our YouTube, and you could probably even find them. No, they wouldn't be on our Facebook. They're too long.
Yes.
But go and see them. The kids did some really good work. It was all of their things that they put together, what they wanted to say and how they wanted to say it, and we did our best to edit it in a way that represented them well. So go and see them.
Right. Well, and along with that, we had to learn how to do and set up a YouTube channel, and and how to make our titles better so that they people would look at them, and we're still working on that. But our YouTube channel is at Quay County Health. So please go visit it and click on the BTG playlist or up-to-date playlist for those videos. And so we did that, and we made it through that first half of that year, and our first half of the first year, and then we'd already started the next part, but we had to create a marketing plan that would encourage people to get up to date on all their vaccines, not just COVID. And
There was a real need for that, just
Yeah.
because with COVID, everybody was not able to go anywhere. And so you weren't able to really go to the health office to see about that. And you weren't really encouraged to be going to anywhere. So everybody
Right.
was staying home, and a lot of these things got neglected.
right. And people, then when we did open up, they were too busy
Yes.
to go. And the doctor's offices were really, really busy. So we had, a lot of people behind. So we did some discussion groups that were sort of like focus groups with different groups of people. We did one all in Spanish. We found some people who spoke Spanish and did them all in Spanish. And then we did a lot of paper survey things. And we went to the places, the low-income housing units, and got information from them. We went to the veterans. We went to lots of different groups to get information on how their feelings and what they thought
Were some issues.
were issues, and maybe what might encourage them to go. And so we created a theme, and our theme is,
Get your ducks in a row.
or in Spanish,
Ponte al tiro.
yes, she says it better than me. So we had this theme, and then we started recruiting local people, local voices, to do radio ads
In Spanish and English.
and English. And I really appreciate Joyce taking on the role of finding most of these people. I mean, I'd found some, and I'd write a lot of the scripts, but she would find the people. And then the radio station worked with us to edit those, record and edit them.
Yeah.
And all of our little ads have a little duck going, quack, quack. And so it's sort of funny. And we actually have a total of 25 radio spots recorded.
Wow.
And we play them monthly, and we've played them monthly since April of 22. And so I think it was April of
I
22.
think that's right. That's just crazy.
And we run about 300 spots a month is what. So right now they're all rotating in, but when we record a new set, then just that one we'll record that month. So we were really ambitious, and we were recording 3 a week or 3 a month for a while, but we've had to taper off because we got very busy making podcasts. And so the other thing that we were doing along that whole same time is we were doing social media posts. So first we were promoting, all the safe habits for COVID and what is COVID and
Where to go if
all
you
that.
wanted to get vaccinated, different places.
Right. And that was part of our equity things that we were doing. But as we got into this grant, then we were able to promote first our Get Your Ducks in a Row and getting up to date. And we were able to share posts with other people in the coalition, and they shared posts with us. So we were able to utilize posts from others. And then we just started focusing on individuals. So over the course of time, we have posted 373 different social media posts in the last 2 years.
Wow.
Based on vaccines. And our impressions are over 20,000.
Wow. It's so nice when we have those numbers to look at it and say we're really reaching out.
And that on Facebook also includes a little brainchild you had of taking our radio ads and...
I would turn them into little short clips with the voice of the people that were there, and then I find the media to go with that, and we've posted those up. And I have forgotten about those.
Yes. So that's how we got a little higher number there. And part of those are all on YouTube. So my favorite, and that's when we were learning a little bit about unique names, is they are free in New Mexico.
That was one of the very first ones we did.
Yes, but it really got a lot of people, a lot of traction. And so we also made videos with adults. And so we made, I think, 3 flu videos, or not
That were
flu,
related. Yeah.
3 vaccine-related videos with adults. And one was really unique where you and Bobby actually went to Rochelle's house,
Oh,
45 miles away.
We had a sleepover out with the cows, and our take on it. And this was Rochelle's idea about how farmers. And then when we presented this later to the BTG group, they were saying, well, even people do this with their pets that they care about. We want to make sure that they're as healthy as possible, and vaccinations are a part of that process. So we just thought that was an interesting take from a more conservative community about, yeah, we do this, so let's think about it and consider maybe this is something you need to do too. So, and we always add with that, talk to your healthcare provider because they know what your issues are, and then you guys work out a plan that you're both comfortable with.
And I guess I didn't write down the title of that one, but I think it's something like, did you, or do you, or something like that.
Oh my goodness, that's so far back.
Yes, it is. But go check it out. It's really cool. And and all these videos are really short, so you don't have to spend a lot of time watching them. And so we did that. And so then our second year, we thought, well, we'll work back with our students, going back to our roots. But we thought we'd work with middle school students because we thought we could do
less busy.
They would be less busy. Yes, we thought they would be less busy.
Yeah.
And we would do it when there's not school, so we could do like a block of time, and we would feed them and all that. And we did. We learned donuts were their favorite. And they would do anything for donuts.
Yeah.
But anyway, we did struggle and ended up having to work on Sundays a lot because of their
Sports schedules were our issue. So,
but we got 3. And one is really funny about acne, a little bit different than the vaccines, but they had a lot of fun, I think, making their videos.
Well, and again, this was their material, this is their idea, and how they wanted to kind of pull it together. And so that, I think that the creative process is really what's the most fun when you're working with your students, because they come up with some interesting stuff. So watch the one on acne.
Yes. So during the second year, we did the middle school, and we also tried to expand into reaching more people at events. So we had previously just looked at doing things like we had the fair and a couple of child finds. And for child finds are where you bring your younger children in to get assessed for preschool and needs and things like that. And so this year we did a fun event called Dr. Seuss's Birthday.
That was a lot of fun.
And there was like 400 people there. It was crazy.
It was packed with kids.
And we were able to give out, we have vaccine coloring books, and we have all kinds of little things for kids. We also did, fair booth, and we did the Halloween block party.
Oh my goodness.
And gave out parent cards and vaccine books.
So many people, yeah.
And there was like 1,300 people. Yeah. It was crazy.
A lot of people.
And snowing.
It was, weather in this part of the country is, you never know what you're going to get.
Right. And we also were invited to several school open houses and things like that. And we're able to set up and present about the podcast and vaccines as well. So we've expanded that, and we have hope to do that. We have been funded again for another year, so we're excited. We'll be able to continue to do some of that tabling and also our podcast. So I mentioned that part of being part of the coalition, we were able to do trainings. And we used our video skills to create our end of the year report last year.
Yes.
And thanks to Joyce and all her creativity. And we received quite a bit of recognition off of that end of the year report. And we was even asked to present at the New Mexico immunization, statewide immunization conference about our work over here. And which is why we've been funded again, because they're so impressed by our variety of our work and our way of reaching out to all the different families. And our numbers may not sound very big but you've got to remember our community is very small.
Yes.
And we look, especially on our Facebook, at organic stuff and
So they're all local
not
people
boosted stuff, right?
that see that. Maybe some people outside do, but mostly it's everybody who's here.
So, and we, of course, have spoke to some other groups about our work, but I thought that was pretty cool to be invited to speak after our first year.
Definitely. And I think this year they told us that they had another group outside of them contact them and said, hey, we'd like some success stories. And they put us on that list. So that's really exciting to be acknowledged for the work that you're doing and that you're doing a good job.
So I did mention that we do get training. And so one of the things I thought I would mention that some of the things that we've learned through, well, I didn't talk about our podcasting.
Oh,
Oh my, podcasting is what we're doing now.
yeah, that was the big ad for this year.
That was
this
our
past
big
year.
ad for this year, and a whole lot of learning.
Yeah.
Going into just how we prepare, how we plan,
The sound again, the
sound
setup,
again.
the lighting, the soundproofing to help our voices not sound like we're talking
Yes.
from a can. There's just
And we
lot.
started with the big mics, so you'll see our older stuff. We have big mics, and then a couple in between because we had technical issues. And then we purchased these portable
and no,
mics.
These are our mics.
And so we've learned a lot about sound and sound quality and editing. And our first ones, we had 4 cameras aimed at us. Now we're down to...
We did an overall shot. You know, it's finding that sweet spot.
And it makes the editing go faster.
Yes.
So we hope that on our next year of podcasting, we'll actually be able to bring you more episodes per month. So, so there was several things I learned during this year from our guests. And one of them that I thought was an interesting thing that has been sort of a change from when my kids were little is that you don't give your kids Tylenol until after they get their shot.
Yes.
Because for some kids, it may slow the absorption of the
It could affect the
vaccine.
efficacy of the vaccine. But we did have one provider say that she was willing to work with you, and if you had a child that you felt needed to have that, she was okay with it. So, so always talk to your provider about those things and see where they stand on that.
And I think the other thing we learned from one of our guests was about some of the controversy going around with the vaccines and autism, because there was a study done and it's been blasted, and all these people take that very seriously, and they're not getting their kids vaccinated. But it turns out, according to later, and this has not been broadcast, that the study was falsified and not accurate. And so now all these people haven't vaccinated. And so because they haven't vaccinated, we are now getting diseases
these
back,
things come back,
that have been eliminated. There are some cases of polio, but right now measles is running across the United States, and New Mexico just got our first 2 cases of measles.
That's right.
And measles is an airborne illness, if I remember reading correctly.
Yeah. So its incubation period is different, and how it's contagious is different, and it's a longer window of opportunity. So
So if you're exposed, it could be 21 days before your symptoms develop, and all during that time you could be exposing other people. And it's very, very contagious. And for many people, they get over it. It involves having a fever, cough, runny nose, and red eyes, followed by a spotted rash that usually starts on our face and head. and spreads to the rest of our body. But if children are under 5 or older adults, it can cause a lot of complications. And those could be including ear infections and diarrhea and sometimes dehydration. And they say in some people they even die.
Well, and the thing with the measles vaccine is that's really an older vaccine that's been around for a very long time. And so I think, just looking at it from that standpoint, it's not something that's newer technology. And so, again, as always, talk with your healthcare provider and you guys figure out what's going to work for your family, but you want to keep them safe, and not just your family, but the people around you as well. You don't want to accidentally get somebody else sick who may have severe complications.
But measles is coming across the nation, spreading across the nation. And if you're vaccinated, you usually don't get it. But if you are unvaccinated,
your risk is much
higher.
Yeah.
And especially if you're traveling outside the country.
Yes.
You should be up to date on all your vaccines to travel outside the country because you're much more susceptible outside our country.
And that's a good thing to check if you're doing any international travel. You want to see what the country you're going to might be requiring and what they recommend from our country to go there.
Yes. So even talking about vaccines has been an uncomfortable topic for us because it is often a very political topic. So we have had to sort of step out of our comfort zone to do this. And so I think our food for thought today should be every step taken outside your comfort zone is a step towards self-discovery.
I think that's absolutely right. Not just with vaccines, but with everything we do. We always want to find that spot where we feel safe, we feel good, and you do want that. But you also need to challenge yourself to expand your horizons, maybe to think about some things that you haven't thought before. The older I get, the more I think I need to be thinking about stuff so that my brain doesn't forget how to do that. And find those. I encourage you to take those opportunities to maybe volunteer or do something that makes you just a little uncomfortable. And I think once you do that, you find this isn't so bad. And it's an encouragement to yourself that I can do these things. I can do hard things, and I can do things that maybe I'm not so comfortable with.
So I was sort of thinking when I read this that this whole process has been outside my comfort zone.
Yeah.
From being in front of the camera, which I hate, to being the leader of this podcast. But through the time we have had, and we have made a lot of good videos that aren't even related to vaccine. Some of my proudest ones are the ones we did that talked about self-care and learning, because that was sort of my thing is you always hear do self-care, but what is self-care? So, trying to answer what is self-care to you.
Yeah.
And
that's different for everybody. So,
and then we convinced a lot of people to get up in front of the camera and do those, and that has been everybody having to step out of their comfort zone. But through that, you do feel like you've learned something about yourself, that you can do that, and that you can be up for a bit harder challenges, I guess, is a way to say that.
Yeah. Because we know that life can be challenging for sure. So you got to be ready to step up and say, I can do this.
Yes. So we're way over time. But I hope you enjoyed this episode of Health IQ Podcast as we sort of gave you a little history of our journey and let you know what we've been up to.
Yeah.
You could always see some of our work on, of course, YouTube for all of our videos at Quay County Health, and on our new web page, which is another new challenge that we had to pick up as part of the podcast at qchealthcouncil.org. And keep coming back, because as I have time, I will keep updating and adding some more stuff, but there's a whole bunch of stuff on vaccines as well there. And come back for our next episode of Health IQ podcast as we look at foods that heal, and especially talking about the 4 steps to making our guts healthy.
This is a really good podcast, is what I can tell you. You want to tune in. So we hope to see you then.
Bye.
Special thanks to our guest contributor, Joyce Runyan, of the podcast committee and assistant coordinator. Our host was Brenda Bishop, the QCHC coordinator. Podcast crew included Robert F. Hockaday. Producer was Robert F. Hockaday and Joyce Runyan. Video crew was Robert F. Hockaday. Music provided by David Morris.
This podcast was made possible by a New Mexico Department of Health Better Together grant. Additional information about today's topic will be on the Health IQ blog located on the Quay County Health Council's website at www.qchealthcouncil.org. Be sure to follow the Quay County Health Council on YouTube, Facebook, and Instagram at Quay County Health. This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.